Welcome to my frequently asked questions about penile surgeries video. I will be reading the questions from the text because there are a lot of different questions. I have explained some of them in the previous videos about elongation and thickening, but I may have missed some of them out. So I will be explaining them all from the beginning. For example, why shouldn't we have sex for 3 weeks after the surgery? Now, we inject fat both in elongation and thickening surgeries. This fat needs to turn into fibrous tissue in 3 weeks. In order to do that, penis needs to stay still. If there is any movement on the penis while it is still an adipose tissue, it will dissolve into blood and disappear. So the solution will be more than expected. But after it turns into the fibrous tissue 3 weeks later, it won't dissolve into blood with any movement. Then the solution will not be more than expected. So you have to wait for 3 weeks to have sex. I can say this clearly because we did biopsies on patients. We saw that the fat injected turns into fibrous tissue. So in a way the tissue dies. The cell sediment turns into the fibrous tissue. You understand that, right? So the cells lose the fluid inside, then they dry, and this is of course leads to a loss in volume. Then it turns into a fibrous tissue. It stays there as a rigid and an elastic tissue for a long time. So the volume loss in the beginning is caused by this fluid loss in fat cells and the fibrous tissue transition process. Another question is if the result is permanent. Everyone wants to have the surgery done and never need it again. And I asked them if they know any surgery that has permanent result. Surgeries that have permanent results are these. Only if you amputate the leg of a diabetic person, it is permanent. Transluectomy and appendectomy is also permanent. If you remove an organ, then that surgery has a permanent result. These are all permanent, because the organ will not grow back. So there are no permanent surgeries except those, even if the kidney transplantation has a validity period. Also the heart transplantation, if someone has a pacemaker, it has to be changed after a while. So you shouldn't expect a permanent result. None of the surgeries provides that. Unfortunately, some patient has an expectation. They want to give them the answer they want. Even if they know that it's a lie, they expect you to lie them. They want me to tell them that we do the elongation surgery without cutting the suspensory ligament, and the result will be permanent. If I tell this, they will run towards please do not expect us to lie to you. Most of the patients expect us to do that. Even if I say that it's not possible, they ask me several times. Like they will get the answer they want when they ask me the third time or so. As a conclusion, these surgeries are not permanent. Do not expect permanent result. Elongation is permanent because we cut the connective tissue and move the penis forward. But thickening is not permanent because the fat injected dissolves after a while. It can happen 3 or 6 years later, and you need to do it again. This is as clear as it is. Let's move on to another question. Unfortunately, this is a really absurd one. Do you inject filler into the glands in order to fix the premature ejaculation? And I ask, what is that? I've never heard of it. There is no such thing as filler injection to glands for treating premature ejaculation. This only happens in Turkey. It's a made-up procedure. This is not a treatment, and there is no treatment like that. And sadly, this rumor spread from my website. I really regret that. There is an article that I uploaded to my website years ago. Someone performed an enlargement operation at glands with the filler injection, and it's not because of the premature ejaculation treatment. They only do it in order to enlarge the the glands. So I found the article interesting as well. It was a whole article with the photos and everything. So I put the link for the article. I thought it was an interesting procedure, but nobody has said that they do that to treat the premature ejaculation. I also think that it was not a convenient procedure because you shouldn't be injecting anything into the glands. And then the smart cookies in our country wanted to monetize it. And they thought, let's say that it numbs the glands, so it fixes the premature ejaculation. Please do not be absurd. Both the doctors and patients are silly for even trying that. The only treatment for premature ejaculation is psychiatric counseling. Like Haydar Dümen says, it will be fixed when you get married. It will get better with having a regular sex life. But there is no such thing as filler injections or surgical treatment. Please do not make these things up. Also, the patients say that it doesn't help at all. Of course it doesn't. The filler will disappear after a while. People also don't know that a filler injection that has been done to the glands is extremely dangerous. Pineal glands do not have separate skin. It is a vein that has a sponge-like shape. If you inject something inside, it will be congested. Filler can be solved after a while, but in Turkey, a doctor has injected fat to one of these patients. They asked me about it later. I don't want to talk about the result because it was horrendous. Please do not have anything injected into your glands. And do not believe in people who say that they treated premature ejaculation with it, because you will be sorry afterwards. It is very absurd thing to do. To fix the premature ejaculation, you need to have regular sex like you do in the marriage, or you need to sue psychiatrists. If it doesn't get better when you get married, you have to see psychiatrists. It is all in the head. Okay, then some people ask how the skin adapts itself to penile elongation. When we elongate the penis, the skin at the back will not peen out. The skin at the bottom won't have any problem because it is connected to the scrotum and the tissue is fit for stretching, but the skin at the back is not. To be able to stretch it, we do either Z or VW plastic. This is not easy topic to understand because even we started to do it on our third year residency. The logic behind it is not easy to grasp. But I explain it to the patients like this. Let's say that this is 10 centimeters long, and let's pretend that this the penile skin at the base, and we want to increase this measurement. We make conjugating triangles and interlock them together. Then 10 centimeters becomes 20 centimeters. But what happens then? Look at the movement of my hands. The right one gets closer to the left and left one gets closer to the right. So we take the elasticity from the sides and give it to the length. This is Z plastic. We don't add an extra tissue, we just change the direction of the skin's elasticity. Okay, what else? pshot. I also think this is another made-up procedure. Do you do pshot and it will help the elongation? Pshot is adding PRP to the fat injection, so it is a fat tissue mixed with PRP, and it is only good for the penile skin. It won't help the penis for elongation. How would it be possible? There will be no elongation without cutting the suspensory ligament. Pshot is just PRP and it won't do any good. If you have a lot of time and money, you can do it. You will see it won't make any difference. Also check the forums. One of my patients searched the forums about it and he learned what is right and what is wrong, and he came to tell me about it. Check the forums, and when you do it, you will see the true colors of this procedure. everyone talks about what is good and what is bad for them. So don't ask me about pshot, because when I learned about it, I didn't even try to do it. It is impossible for it to help any elongation. If the suspensory ligament is not cut, penis will never be elongated with the pshot nonsense. Besides that, one of my patients saw the photos that were taken during the surgery, before and after photos. Then he asked me an interesting question. He asked me, how was the atmosphere like when you were taking the photos? Because penis relaxes a bit when the weather is hot, and it can look longer than the usual. I think it is a good question. We take the photos right before and after the surgery, right in the OR. People usually do not come to the clinic. Even if they do, they come for the second fat injection, and we operate on them once more. So we take the photos in the cool operating room right before and after surgery. The atmosphere must be cold. The operating room is kept cool all the time. Air conditioning is always on because we want to slow down the patient's metabolism in order to lessen the bleeding. So we keep the room cool. So photos are generally taken in the same atmosphere, and we take them under the same light. We don't do it any other way. So there will be no illusion of light, and penis won't look longer because of the heat. We do it just like I have told you. And also, one of my patients asked a very interesting question as well, and this is really very important. He asked, are these surgeries legitimate? Are they approved by Ministry of Health? Of course they are. The surgeries are performed globally, and also it is catalogued in the Ministry of Health lists. It is listed as penile enlargement, so you understand that, right? It is cataloged in all the official lists that are used in the state hospitals. We do not perform a made-up surgery. It is also been in the classic textbooks. This has been done, God knows for how many years. Maybe not for 100 years, but it must be at least 60 or 70 years. As I've told you, this is not a made-up surgery, it is a classic surgery, and we only have made a couple of modifications on that, and I have told you about that. This question is always asked to me. I have answered in one of my videos before, but I will explain it to you once more again. One person died because of this surgery, but you say that this surgery has no risk and complication. Look, yes, one person died because of this surgery. So the rate was 0 before him, and he died because of fat embolism. While injecting fat to penis, they inject it into the vein, so he died because of that. It has nothing to do with the penile enlargement surgery. They probably use a syringe when doing the procedure. Since the syringe has a sharp tip, you may puncture the vein and inject the fat inside. So their technique was wrong. Normally we do the procedure with the cannulas. It is also a cylinder that has a round tube. It injects the fat from the hole on its side. So when you do it, it will not puncture any vein. It will not go inside because it has a closed round tip and it looks like a ballot. It injects the fat from the inside, so there are no risks about it. We are really comfortable when we are at the surgery. I think they use a syringe, so it punctured the vein and injected the fat inside. The reason of his death is this. This has nothing to do with the penile enlargement surgery, because the doctor who did the surgery followed completely false technique. If you do the surgeries in accordance with the correct technique, nobody dies. It is impossible for someone to die because of it. You have to inject the fat inside the vein, and in order to do that, you have to use
herhangi bir
to
ameliyatta
use a
dünyada
syringe. There isn't an
şimdiye kadar
explanation
bir
for
kişinin
this.
öldüğü kaç tane ameliyat var acaba?
How many type of surgeries
Yani
are there
her
in the world
ameliyattan
that has
belli
only
ölüm
one
sayıları
death
vardır.
rate?
Bademcik
In every
ameliyatından
type
da
of
bir sürü ölüm
surgeries, there is
vardır.
a
Ne
death
bileyim yani.
rate. Even in the
Düzenli ameliyatı
tonsillectomy
sırasında
or
bir sürü
even
ölüm
the
vardır.
facelift operation,
Liposuction'da çok
a
vardır.
lot of people die
bunların
in
içinde
liposuction
şimdiye
operations.
kadar tek
Only
ölüm
one
olmuş
person
bir
died
ameliyattan
in a penile
bahsediyorsunuz.
enlargement surgery, and this is all you talk about. So we cannot say that surgery is extremely safe. Please do not be scared of it. That patient died because of the malpractice. All right. Some people ask if the glands stay small when the shaft is thickened during the thickening surgery. We used to inject 70 or 80 cc fat and it was too much. Then it used to stay small. It looked bad. But then we have learned that when we inject 70 or 80 cc fat, people have a hard time on erection. We have also seen such cases, and I have told you all about it in my thickening video. Since then, we have lowered the amount into 60 cc, and in some cases, we inject 50 cc. It is enough for a penis to thicken and also pleases both of the patient and his partner, and it doesn't cause any disfiguration, so we shouldn't be injecting any extra filler to the gland. It is also not right to thicken the shaft that much since it will cause an erectile dysfunction. So you don't need to worry about it when we inject 50 or 60. It won't cause any disfiguration, and it won't cause any erectile dysfunction. Then the patients will be pleased with it. We have found the right way to do it throughout the years. If you want to invent something that has been invented before, that is your business. You can begin with 70 or 80 cc. Other than those, some people say that some clinics guarantee 5 centimeters elongation, and they even have photos on their website. They send me the photo, and the penis really looks like way much bigger than the normal. If you believe these things, you can try it out, but if they cannot deliver their promise about 5 centimeters, you should sue them. Okay. Is that okay? Those photos are just Photoshop fraudulence. These surgeries have limits. I have told you what should be done in order to be successful at these type of surgeries. You should keep the patient expectation within the reasonable limits. If they expect a 10 centimeters long elongations, they're not going to be pleased anyway because it is impossible. You should keep the patient expectation within the reasonable limit. You need to talk about the limits of the surgeries properly. You should say this is all we can do, and you shouldn't be expecting more. If you ensure them with unreasonable measurements and convince them with Photoshop photos, they will never be pleased since their hopes will be way higher with your false claims. Even if you do the surgery within the reasonable limits and elongate the penis 2 or 3 centimeters, they're not going to be satisfied with it. I say this all the time. If they can deliver their promise about 5 centimeters, you should sue them. This is what you should do. Because if a doctor lies that much, he deserves it. I don't want them to get into any trouble, but if they make up so many lies about the suspensory ligament and elongation, it means that they deserve a lawsuit about it. Besides that, I have told you about this in previous videos, but I'm going to talk about it one more time. Some patients come to me and say, I have seen another doctor and they have told me that your penis length is normal and this surgery is only for the people who are small penis. I hear it a lot of times. They even text me about this.
Ameliyat konusunda
If you
bilgin
don't
yoksa,
have
hiç
any
yapmamışsan
information
bari bunu
about
söyleme.
these surgeries, please
Yani
don't say
hakikaten saçma
this
sapan.
stuff
İki cümle söylemiş,
at
ikisi
least,
de yanlış.
because it is nonsense. They say two things
Hasta
and both of them are
size
wrong. Patients do not
penisin
come to
küçük
see
diye
you
gelmiyor.
just because they have small
Hasta
penis.
penisim
They
daha
come
büyütmek
to
istiyorum
you
diye
to
geliyor.
enlarge penis
Bunun meme
and
büyütmek
elongate
isteyen
the
bir bayandan
penis.
farkı yok.
And it's
Aynı
no
şey.
different than a breast augmentation.
Meme büyütmek
If
için
a
gelen
woman
kadın biliyor
comes
musun
to
sen?
you for a
Sizin
breast
breast
augmentation,
büyütmeniz olma
would you
gerek
say
yok.
that your breast looks fine and
Ya
you don't
saçma
need
sapan
to
bir şey olur bu.
have this
Hasta daha büyük
procedure?
olsun diye gelmiş ya. Bunun
Because
nasıl hayır gerekir
that would
dersin?
be absurd. They come to you only to make it bigger.
bu sebeple
You
gelir. Daha
you
büyük
cannot
olsun
send
diye
them
gelir.
back. 99% of the
Bu
patients come
yüzden
to
size
your
gerek yok falan
clinics
demek süper
in order to
saçma.
make their penises
Adamın penis
bigger.
boyu 18
So it's
santim,
quite
20
absurd
santim
to
bile olur
say
ya.
that they do not
Ama
need it.
daha büyük olsun
Their
istiyor
penis
adam.
length can
Yapabilirsin
even be
bunu.
18 or 20 centimeters
muyum?
long,
Hastayı reddetmek
but they
kadar
want to
saçma bir şey
make it bigger.
O
You
cümle
can do
yanlış.
this. It is
Hasta
so
büyüttürmeye
absurd
geldim, daha büyük
to
olsun
reject
istiyorum dersen
those patients.
yapılacak
It's
bu
wrong
yani.
statement. If they come for an enlargement, you have to perform the procedure. It's not a weird thing to do. This surgery is for the people who have small penis. This is also wrong. If a doctor says that, it means they don't have any information or experience about this surgery. If he had done it once, he would have known that this procedure is not for the small penises. So why? Because in the penile enlargement surgery, we free the connective tissue that is anchored to the bone and move the penis outwards. We do not any extra stuff. We just move the material at hand forward. We use the tissue we already have. If they have a small penile tissue, it may even 5 centimeters during the erection. You cannot move it outwards because your material is also small. You cannot perform this operation on people who have small penises. You cannot solve the micro penis problem with penile enlargement surgery. Doctors who have no knowledge but still talk about this topic really annoy me. This is also a fact. His two statements are false. Although we like him very much, Heidelman also wrote about this on the newspaper. He says the same thing to his patients. My weight is this and my height is that, and I want a penile enlargement surgery. And Heidelman says that this is a vitamin. Your penis size is normal, and the surgery is for the people who have small penises. He doesn't even know about it. It is quite normal for him not to know anything about it because he is not a surgeon. But he should have consulted with a surgeon. Can you remove the fat around the penis? I have also told about this before. If someone comes with this request, they probably want an elongation surgery because this kind of request is nothing and absurd. You may want to remove your abdominal fat. You may want a breast or facelifting. These are all visible parts, but why on earth would you want to remove the fat around your penis? It stays in your underwear. The only reason for it is to have an elongation surgery. Every patient I have been talking to have said that they have come for elongation surgery because I say if you think there will be an elongation when fat is removed, it is not going to happen like that, and you will be disappointed. You can do lipo to that area, but please do not come to say there is no elongation because it is not elongation method. Some of my patients are shy about it. They come to me saying that they want me to remove the fat around their penis. Doctors should be aware of this. If the patients come with this kind of request, you should say that there will not be any elongation with this procedure. Then they will admit what they really want. because they want an elongation surgery, then you need to explain the elongation surgery to them. So you should be aware of this type of situation. If you remove that fat just as they have asked you to do, they will not be pleased with it and come back to you later on. This is not the doctor's fault, but they also need to be on the alert for these situations. Besides that, this used to be a frequent problem before, but now I explain this to my patients. You perform the penile enlargement surgery on patient. Then he calls you 2 months later saying my penis tilted over one side, but we didn't do anything to cause this kind of problem. When I look at the photos before the surgery, we see that it's tilted over to one side, and it was on the left side as well. So it used to be that way before. I sent him the previous photos and say that it was like that before as well. He didn't pay attention to that before and the surgery, but after the surgery he started to pay attention to that as well. So he thinks the surgery caused this, but it didn't. When we took the photos before the surgery, we leave the penis as straight as possible. If it tilts to left, we take the photos as it is. I mean, whichever side it stands, we take the photos. We don't change the position. We take the photos in its natural state, right before and after the surgery. But if they call me and say that it showed the wrong direction, I show them the photos because it didn't do it. It is the way his penis is. But he's not aware of it. There are a lot of questions on my notes, but I have answered most of them in the elongation and thickening videos. For example, will the penis be saggy or will there be an erectile dysfunction when we cut the suspensory ligament? These are all absurd questions, and I have told you all about it. Cutting the suspensory ligament will not cause any problems for the patient. Do not pay attention to this silly stuff. I used to perform the classical method on the elongation and thickening operation. I used to cut the suspensory ligament completely. But even if you do it, there won't be any sagginess. But now I cut the 80% of it. This method will not cause any sagginess, but some doctors who do not have any knowledge start rumor about it. They also know that the patients are scared of it, so they say that they perform the surgery without cutting the suspensory ligament. This is not true. You cannot elongate the tissue without cutting the suspensory ligament. If someone says that they can, I expect them to send me the scientific article about it. This question is also asked frequently. Can you fix the foreskin? Can you replace the skin? This has been a popular topic lately. I think people are more informed about it and conscious because the purpose of circumcision is to lower the sexual pleasure. The main purpose is this. So why is that? Because foreskin is a tissue that wraps the glands around. Why? In order to protect it from the external factors. It prevents the glands to make a friction with the underwear. Glands has a sensitive skin around it. So foreskin wraps and protects it. It is like a cover, but foreskin is removed during the circumcision. So the skin gets thicker after this procedure and it loses its sensitivity. So circumcision lowers the sensitivity and a sexual pleasure.
azaltır sünnet.
but patient knows
Yani
about
cinsel hazzı
it. Some
azaltır.
foreign textbooks say that circumcision is the worst thing to do for a man because the glands will
Hatta
lose
bazı İngilizce
sensitivity
kitaplarda şey diyor,
forever.
sünnet diyor,
So people ask if we can
hastaya,
replace that
erkeğe yapılabilecek en kötü
skin.
şeydir diyor.
We have some
Çünkü
methods
hayat
for
boyu
that
o
as
penis
well.
başının hassasiyeti artık bir daha
We
geri
cannot
gelmez.
restore
Öyle
the
kalır.
sensitivity. Glands will
Hastalarda
not be
bu
the
dili
same
yerine
as
konup
it used to
konamayacağını
be.
soruyorlar.
It is now thickened.
Var böyle yöntemler. Bu dili yerine
I
konabilir
mean,
ama
this skin
şu
can
var.
be placed in its own place,
Penis başının hassasiyeti geri
but
gelmez.
the
O
sensitivity
eski narin ince cildine
cannot
ve
come
hassas
back.
duyarlı cildine kavuşmaz tekrar. Orası artık nasıl tutmuştur yani
So
kalılaşmıştır
the reason
penis
for the
başı.
glands to be to
Erkeklerde
look cracked
sünnetli
is
erkeklerde
circumcision.
penis başının böyle çatlak çatlak ince çatlaklar olması
For example,
ondan
there are some
basılaştığı için.
cracks, especially in the tip of the
Yani
penis.
deri yerine konabilir ama sadece görüntüde sünnet
We can restore the sensitivity, so I don't recommend this procedure to my patients.
O yüzden
There is
çok
no
tavsiye etmiyorum
point in
bu
performing
ameliyatı.
a surgery
Sadece
just for
sünnet
sake
derisini
of
yerine
it
koyduk diye
because
ameliyat
it will
yapmanın da bir anlamı
not
yok.
be the same.
Yani herhangi bir eski haline dönmeyecek çünkü oradaki hassasiyet. Neyse bu konuyu da zaten ayrı bir video olarak koymuştum galiba.
I think I have
Hasta
mentioned
konuda.
about this topic before as well in
Burada
another video.
söyleyebileceklerim bunlar.
I
Daha
mean,
birçok
these are
şey
the
var
things
ama
that I would like
bunları
to talk about
yeni
it
gelmiş ve anlatmışım ben zaten birçok
in this
videoda.
topic.
Önceki videolarda anlattığım şeyler var. Evet çoğunu
Yes,
evet,
I
hepsini
have
anlatmışım.
explained them all.
O not aldığım şeyleri anlattım.
So
Tekrar
I don't
hiç
need to do
anlatmıyorum o
it
yüzden.
all over again.
Hani uzatma ve
You can find
kalınlaşma
those in
videolarında
elongation and
diğer
thickening
anlatabileceğim
videos.
şeyler
But if you have any
söylenmiş.
questions, you can message me.
Yine de bu konularda
You will
bir sorunuz,
find the
bir şey
addresses
olursa bana
and the
mesaj
phone
atın.
numbers at the
Videonun
end of the
sonunda,
video. I will
adres,
try to
telefon
help you
vesaire
in every
gözükecek.
possible way.
Her konuda yardımcı olmaya çalışırım.
I have some websites which are still on progress.
Hazırladığım
I will
bir iki
also
web
upload
var.
these videos to
Henüz
those
bitmedi. Bittiği
websites.
zaman
Thank you
videoları
very much
onlara da
for
koyacağım.
watching.
Tekrar
See
görüşmek
you
üzere.
soon.
İzlediğiniz için teşekkür ederim diyorum. Umarım faydalı olmuştur.